All right, so thanks for joining us, everyone. I'd just like to welcome you to this afternoon's webinar on the COVID-19 vaccine, facilitated by Dr. Stefano and Dr. Marina. So I'm Brianna, I'm the Community Awareness Officer here at Headspace. So firstly, we'd just like to acknowledge the country that we're on here at Headspace Mildura and the Mildura Base Hospital. We'd like to acknowledge the traditional owners throughout the Maori region on whose land we work and live as the first people of this nation. We also pay respect to all elders past and present and honour their culture. So just a couple of housekeeping notes to start with. So as I said, this session is going to be recorded and posted on our website. So if you don't want to be identified, please feel free to leave your camera off and change your Zoom profile name. There will be an opportunity for questions following the presentation. So you just hold those questions until the end, and you can either put your hand up with the reactions function down the bottom and we can come to you, or feel free to put your questions in the chat box. Please be respectful towards our speakers today and other participants, and please note that this session is just a general overview of the vaccine and safety advice. For any specific queries relating to your personal circumstances, we encourage you to speak with your GP. All right, so I will pass over to you, Stefano and Marina. Thank you.
Can you guys see that? Yeah.
Yes, thank you.
Perfect. All right. Thanks for that, Brie. My name's Dr. Stefano Prisco-Penna, which is Steph for short. I'm a psychiatry registrar, currently working at Child and Youth Mental Health Service. Yeah.
Hello, my name is Marina. I'm one of the doctors at Mildura Hospital. I recently started in mental health. I worked for the emergency department for 3 years with a plan to start practicing in Mildura as a GP for next year. So today we will be talking about vaccine development. How do the vaccines work? Vaccines efficacy, side effects, safety, and recommendations. So let's start by vaccine development and approval. I guess one of the questions that comes up from everyone, how were the vaccines developed so quickly? So the biggest reason is our nations have invested a treasure in the development of these vaccines. Our country and many countries globally have invested billions of dollars to make sure that we have these vaccines quickly, because we are facing a pandemic of such consequences. It's actually very important to know as well that none of the phases of the development of the vaccines have been skipped. They only kind of overlapped. So in Australia, we have Pfizer and Moderna and AstraZeneca. So Pfizer and Moderna are the mRNA vaccines, and AstraZeneca is the vector vaccine. So how do these vaccines work? So they all have the same principle. So when we have the injection, so this has like a genetic code. So in Pfizer and Moderna, the genetic code is the mRNA. So what is this genetic code? So it's basically just like a recipe for our body. So when our body reads this recipe, it starts making the spikes protein, which are similar to the spike protein on the coronavirus. And then the body destroys this genetic code. And then the body realizes that this spike protein doesn't belong there. So it starts forming antibodies, which are the fighter cells against the spike protein. And again, the spike protein is destroyed. But the amazing thing about our body is the memory sense. So now the body recognizes spike protein, has the fighter cells. So as soon as you are exposed to the virus, your body already starts fighting the virus because it already has the antibodies, without even you knowing that you might been exposed to the virus. So you might not even have the symptoms. So it's very important to know that these vaccines do not have the coronavirus inside. it's impossible for these vaccines to give you the coronavirus, and it's impossible for these vaccines to affect your DNA. So vaccines efficacy. So after having your first dose of Pfizer, you will have 47% protection against infection, 33% protection against transmitting the virus to someone else, 47% protection against having symptoms, and about 71% protection against hospitalization, ICU, and deaths. After the second dose of Pfizer, you will have 80% protection against having the infection, 56% protection against transmitting the virus, 85% protection against having symptoms, about 87% protection against hospitalization, 89% protection against ICU admission, and 92% protection against death. And regarding AstraZeneca, so after your first dose, you have 43% protection against infection, while your protection increased to 62% after your second dose. After first dose, you have 24% protection against transmission and 45% protection against transmission after your second dose. After your first dose of AstraZeneca, you'll have 43% protection against having symptoms, and your protection increased to 71% after your second dose. Regarding hospitalization, so after your first dose, you have 69% protection, while your protection increased to 86% after your second dose. Regarding ICU admission, so you have 69% protection after first dose and increases to 88% after the second dose. And regarding death, so after first dose, you have 69% protection and about 90% protection. And Pfizer and Moderna are pretty much similar. So regarding side effects, so actually the local and systemic side effects are common after COVID vaccines. They're worse after the second dose of Pfizer and worse after the first dose of AstraZeneca. So these side effects include pain, tiredness, headache, aches, fever, and pain and swelling around the injection site. Anaphylaxis, which is a rare side effect, which is serious allergic reaction, is actually rare. It's about 4.7% per million doses of Pfizer and 1 per million doses of AstraZeneca. So I had my 2 doses of Pfizer in April and May. So after my first dose, I had some swelling and injection pain around the injection site. Lasted for a couple of days. After my second dose, I was feeling a bit achy just for a day, and then with some rest and some Panadol, I was fine. My husband has his AstraZeneca in April as well. He's in early 40s, and he had AstraZeneca, and he didn't have the serious side effects, the clotting one, which we will talk about in a minute. Only after this first dose, he was a bit chilly, had some fever, and again, we are both fine. So regarding there has been a side effect which has been associated with AstraZeneca. It's called the thrombosis with thrombocytopenia syndrome. So thrombosis means clotting. Thrombocytopenia means decrease in cells in our body. They're called platelets. It's actually a rare, very, very rare side effect, but serious. It's different from the general clotting that we know. It's kind of a response from the immune system, and the immune system forms antibodies against the platelets and makes them a bit sticky. So this is why we have clotting and thrombosis. And then the body starts destroying the platelets, and this is why we have decrease in the number of the platelets. If it happens, it usually happens around the 4 to 42 days after the vaccine. Till now, so far, the only risk factor is age. So it's been more reported in younger adults than older adults. So this is why now AstraZeneca is mainly recommended for 60 and above. About 15 cases per million adults vaccinated had this side effect. In Australia, we didn't have any confirmed case after the second dose. But the good thing is now our clinical awareness about this side effect is very, very high. So usually the symptoms will be headache, but would be severe headache, which persistent, which doesn't really improve with painkillers. Can be shortness of breath, chest pain, severe abdominal pain, pain and swelling in the legs, and some bruising away of the injection site. So if you had any of these symptoms, you should seek medical advice. And as I said, the clinical awareness is very high and suspected cases are rapidly treated. And here in Mildura Hospital, we have a treatment protocol, and in most of the hospitals in Australia, we have a treatment protocol. So cases have been treated quickly and the prognosis is actually good. It's important to know as well, there is no increased risk for people on blood thinners or who had previous history of blood clotting anywhere in the lungs or in the leg, or previous history of heart disease or stroke or even low platelets. There is no increased risk with AstraZeneca. Thank you. And now I'll pass it to Steph.
Thanks, Marina. So the other sort of big side effect, I guess, that has come about, and I guess is more prominent in the news, is around Pfizer and Moderna. So the main sort of adverse event that they talk about is myocarditis and pericarditis. So myocarditis is the inflammation of the heart muscle, and pericarditis is inflammation of the lining of the heart. So this only happens with the Pfizer and the Moderna vaccines, and because they're very similar vaccines, their effect and side effect profiles are pretty much the same. So it's more common after the second dose. It tends to happen in young men aged between 12 to 24. Usually occurs within 1 to 5 days after the vaccine, after the second dose. And it's self-limiting and mild, i.e. it will kind of resolve by itself. It's important to know that any pre-existing cardiac conditions are not contraindications. That is, if you have a cardiac condition, it doesn't mean that you can't have the vaccine, but obviously the recommendation would be that you seek out medical advice from the GP and cardiologist if needed. And in fact, even having had recent myocarditis or pericarditis for any other reason, or even ongoing, is not a contraindication to getting the vaccine. To put it into a bit of perspective, the risk of developing it after a second Pfizer or Moderna dose would be 3 people in every 100,000. But I think it's important to remember that actually COVID itself, along with many other viruses, are also the cause of myocarditis and pericarditis. So the risk generally with COVID in causing these conditions is 11 people in every 100,000. So it's almost twice was 4 times as much as with the vaccine in terms of risk. But there's often concerns around sort of the perinatal period, and it's important to know that there's absolutely no increased risk for those who are planning pregnancy. There is no increased risk for those women who are breastfeeding, and no risk for any woman who is currently pregnant at any stage of the pregnancy. And pregnant women are now eligible regardless of age. And largely the recommendation would be for Pfizer and Moderna, but that's not to say they couldn't have AstraZeneca, although that was recommendations around when supplies were not quite as much as they are now. And these were also these recommendations developed with the TAGI, the immunization body, and the College of the Obstetrics and Gynecologists, and to add the recommendations around the vaccine and the risks of myocarditis. That was also sort of agreed with the College of Cardiology and TAGI. And in all of this, the benefits far outweigh the risks. And yeah, again, it's important to note that actually, the risk of developing COVID when someone is pregnancy is a much more significant risk than that one would get with the vaccine. Again, while it's sort of in this sort of general domain, the other things that are cropping up are sort of queries around fertility and menstrual changes. Certainly with fertility, there's absolutely no impact. And I think there were sort of similar concerns with the HPV vaccine, and certainly there is absolutely no indication that that has ever caused any fertility issues. And again, there's no theoretical reason why these vaccines should be causing any fertility issues. Regarding the menstrual change, again, no theoretical reason why that should be the case. Obviously, as Marina said, these things are constantly being monitored and observed, but that's not a reason why we would not give the vaccine. Again, some people may have concerns around, the contents and what that might mean in terms of faith and belief. So COVID vaccines are halal, and in fact, many leaders within the Islamic community are really pushing for people to get the COVID-19 vaccinations. They don't contain any cells from an aborted fetus. They don't contain any animal products. So the recommendations, so these have changed a lot, even since we first started doing this presentation, so we're constantly having to update it. So it is a bit of a minefield to try and keep track of. But essentially now, and then we have Moderna, for anyone over 18 and including over 60, they're approved for all vaccines. So even if you're over 60 now, you can also receive Pfizer and Moderna, whereas before you could only receive the AstraZeneca. However, in the 12 to 17 age group, it can only be the Pfizer or Moderna. So AstraZeneca is not licensed in that age group. Studies are currently underway for under 12s. So I think the next sort of age group will be sort of 5 to 12, and then it's sort of 2 to 5, and then I think 6 months to 2. And again, those studies are sort of all underway. Minimum intervals for all of the vaccines, so Pfizer is 3 weeks, but generally you'd say it's sort of 3 to 6 weeks, but we kind of go down to the minimum interval when there's a crisis or an outbreak, as there is at the moment, and as there was in New South Wales. And so Moderna, it's only 4 weeks. There's no real range there. It's only ever been 4 weeks. And AstraZeneca, again, the minimum is 4, and that's the general interval that you would give when there is a big outbreak, as at the moment, but that can go up to sort of 12 weeks. So that's everything from our point of view. So we're really happy to hear any questions and hopefully try and answer anything that you might have any concerns about. Yeah.
Thanks so much for that, guys. We'll just give it a few minutes for people to pop their questions in the chat, or feel free to, well, there's only a few of us here, so feel free to just unmute yourself and ask a question if you would like.
I actually have a question. I have 2 young children, 10 and 12, and I guess the question I'd like to ask is regarding the vaccinations and hormonal changes, the huge amount of hormonal changes that children go through as they go through puberty. What evidence is there to demonstrate that these vaccinations are safe for children going through those pubescent years? Can you sort of relay any information that you may have come across or read or evidence?
No, thanks for that, Georgia. I guess, certainly from the information we have and sort of attending sort of webinars by, sort of eminent experts in the area, there is certainly no indication that the vaccines would be causing any issues in relation to sort of hormones or anything sort of endocrine, I guess. And certainly if there was an issue, we'd know about any side effects in that regard with the vaccines in the 12-year-olds. In a sense, although Australia was delayed in getting all the vaccines, in some respects it's been quite helpful. A lot of what we know about the vaccines has come from countries that have been using the vaccine for quite a while now, particularly the US, Canada, and the UK. So we actually have some pretty robust data and evidence from those countries about how these vaccines work and the side effects that they cause. And the other good thing, I guess, is that Australia is actually very stringent in its immunisation body, probably almost more so than some of those other countries. So if there is the slightest hint that there is an issue, then these things change. And the prime example of that would be the AstraZeneca, where, initially it was kind of for everyone, but then, there were concerns about this clotting syndrome. And so then it was stopped for that certain age group. Until we had more information. And certainly it's now been, I guess, almost well over a year now that we've got these vaccinations going, and there's not been any indication that there's been any issues with hormonal problems. And certainly that's nothing that's come up in any of my reading or, in the research that I've looked at. Does that answer your question, or was there anything sort of more specific that you thought?
No, thank you. That does answer my question.
Yeah.
Terrific, thank you.
No worries.
Actually, one other question I do have is with my 10-year-old, when may it be likely that the vaccination possibly will become available for those under 12?
We don't know yet, but so this is like, I know that they've been, I have a 6-year-old as well, and I'm waiting for them to approve it for them. So we don't know yet, but I know that in the US, I'm not sure if they started already vaccinating less than 12, but I think I'm not sure if it will be by the end of this year in Australia or maybe early next year, but I think they're doing, I think Pfizer had, they did lots of studies and they submitted their paperwork already. And Atagi and our vaccination body, they're studying that. So I think it's soon.
Yeah, I think my understanding I think the data and the studies are still ongoing. And like I said, they're actually doing the studies down to 6 months now. But they're still waiting for the data to come out of those studies. That could potentially be as early as in the next couple of weeks. But it then takes some time to come from the studies to Atagi actually approving it. So I would imagine probably sort of early next year would be my guess. But there's not been any sort of word from authorities about that.
Thank you.
So there is a question about boosters, that some countries started giving boosters, and what's the current plan for boosters here. Again, we don't know yet about the boosters, and this is under studies. So it's most likely that we might need a booster, but still they're studying this. And I think, as we discussed, given after having your 2 doses of vaccine, you have a very high protection against the infection. So the main point now is to get most of the community vaccinated. So because this would give protection to everyone, but certainly they're studying when boosters would be, if boosters would be required or no, and when they would be required, but most likely yes, but still under study. Yeah.
Mm-hmm. Yeah.
Thank you.
We know it can be hard when people are on the spot to think of any questions, but yeah, we'll leave this open for a few more minutes if anyone does think of anything. But I believe you mentioned last time there's a good FAQ page on the DHS website in case anyone does think of anything after this session. They can go to that resource, and that should be able to answer some other questions.
Yeah, have you got that link, Bree?
I will just find it and I can pop it in the chat.
Yeah, that'd be great. Yeah.
So there is a question, can you explain how being vaccinated keeps the rest of the family safe? So I'll just go back to our table. So yeah, as we discussed here, so after having your vaccine, so like regarding Pfizer, so after having your second dose of Pfizer, you have 50%, 56% protection against transmitting the virus. So if you had your two doses of vaccine, yes, so your risk of transmitting the virus decreases about the half. And after AstraZeneca, after again the second dose, you have 45% protection against transmitting the virus. And having the vaccine will actually decrease your risk of having the infection. So if you had your two doses of vaccine, so your risk of infection is already low. So again, risk of giving the infection to someone else is low. Yeah. Does this answer the question? Thank you.
So I've just popped that link for the FAQ page in the chat if anyone wants to have a look at that. And yeah, just a reminder, this was, just general overview. If you have any specific concerns, do go see your doctor and they'll be able to point you in the right direction and give you some advice that's tailored to you.
Thank you very much, everyone.
That's all right, no worries.
Thank you for joining us. I haven't got anything in my chat. I'm not sure whether some were coming through to you privately. No. So we might finish there. And yeah, so we'll be putting this one up on our website and our social media. So feel free to watch it back, if you needed a refresher. And yeah, thank you so much for joining us today, guys.
Cool.
Thank you, everyone.
Cheers.
Terrific. Thank you, everyone.
Thanks. Bye.
Just before I leave, can I just ask, will it be posted on the Headspace website or the Mildura Base Hospital website?
I'll definitely be putting it up on the Headspace website.
Yep.
And yeah, I'll contact the hospital and see if they're happy to put it up as well.
Okay, terrific. Thank you.
No worries.
Thanks.
Thank you.